Hi all, this is your Endless Nurses World. Welcome to this channel. Today we are going to talk about maternity nursing related questions. It is important those who are going to write nursing officers exam. The first question is, the nurse is preparing to teach a prenatal class about fetal circulation. Which statement should be included in the teaching plan? Select all that apply. The options are, ductus arteriosus allows blood to bypass the fetal lungs. One vein carries oxygenated blood from the placenta to the fetus. The normal fetal heart rate tone range is 140 to 160 beats per minute in early pregnancy. Two arteries carries deoxygenated blood and waste products away from the fetus to the placenta. Two veins carry blood that is high in carbon dioxide and other waste products away from the fetus to the placenta. In fetal circulation, we should know about the structures of fetal circulation. Ductus arteriosus, one umbilical veins and two umbilical arteries, foramen ovale. Ductus venosus. So the ductus arteriosus allows blood to bypass the fetal lungs for minimal tissue maintenance. One umbilical veins carries the oxygenated blood from the placenta to the fetus, and two umbilical arteries carries the deoxygenated blood from the fetus to the placenta. So it is very important. The next question is, the nursing instructor asks the student to describe fetal circulation, specifically the ductus venosus. Which statement by the student indicates an understanding of the ductus venosus? So options are, it connects the pulmonary artery to the aorta, it is an opening between the right and left atria, it connects the umbilical vein to the inferior vena cava, it connects the umbilical artery to the inferior vena cava. See, the connections are important in fetal circulations. So the ductus venosus connects the umbilical vein to the inferior vena cava, and the foramen ovale, it is a temporary opening between the right and the left atria, and the ductus arteriosus joins the aorta and the pulmonary artery. These three connections, it is very important in fetal circulation, and it is important questions. The third question is, a pregnant client tells a clinic nurse she wants to know the sex of her baby as soon as it can be determined. The nurse informs the client that she should be able to find out the sex at 12 weeks gestation because of which factor? The options are, the appearance of the fetal external genitalia. The second one is the beginning of differentiation in the fetal groin. The fetal testes are descended into the scrotal sac. The internal differences in males and females becomes apparent. See, the answer should be the appearance of the fetal external genitalia, because by the end of the 12th week the external genitalia of the fetus have developed. So in that condition we should know the sex of the babies. So in at the end of the 7th week the differences, male female differences will happen. In scrotal descent will happens at the end of the 38th weeks of gestation. So the external genitalia differentiation occurs at the end of the 9th week. It is very important question. Next question is, the nurse is performing an assessment on a client who is at 38 weeks gestation and notes that the fetal heart rate is 174 beats per minute. On the basis of these findings, what is the priority nursing action? First one is document the finding, and second, check the mother's heart rate, and third, notify the healthcare provider, and fourth, tell the client that the fetal heart rate is normal. So the fetal heart rate is, in early pregnancy it is about 160 to 170 per minute. In late pregnancy, based on the gestational weeks, the heart rate is 110 to 160 beats per minute. If the heart rate is less than 110, if the heart rate is less than 110 or more than 160, it is very important to notify the healthcare provider. We should know the fetal distress. The next question is, the nurse is conducting prenatal class and the female reproductive system. When a client in the class asks why the fertilized ovum stays in the fallopian tube for 3 days, what is the nurse's best response? The options are, it promotes the fertilized ovum's chances of survival, it promotes the fertilized ovum's exposure to estrogen and progesterone, It promotes the fertilized ovum's normal implantation in the top portion of the uterus, and it promotes a fertilized ovum's exposure to luteinizing hormone and follicle stimulating hormone. The answer is it promotes the fertilized ovum's normal implantation in the top portion of the uterus because the tubal isthmus remains contracted until 3 days after conception to allow the fertilized ovum to develop within the tube. The next question is, the nursing instructor asks the nursing student to explain the characteristics of the amniotic fluid. The student responds correctly by explaining which are characteristics of amniotic fluid. Select all that apply. So the amniotic fluid characteristics is very important. So the first one is the amniotic fluid surrounds the fetus, and it feels like a cushions and protects the fetus, and it allows the fetus to freely move into the uterus and maintains the body temperature. In addition, the amniotic fluid contains urine from the fetus, and it can be used to assess the fetal kidney function. So these are all the functions of amniotic fluids. A couple comes to the family planning clinic, asks about sterilization procedures. Which question by the nurse should determine whether this method of family planning would be the most appropriate? So the options are: did you ever had surgery? Do you have plan for any other children? Do either of you have diabetes mellitus? Do either of you have problems with high blood pressure? So the couples, when you are coming for the family planning, we have to ask for first questions. You have plan for any other children, because the fertility procedures, it is a reversible procedure, it is not as successful. So we should ask the questions for the couples, plan for any other children. Next question is, the nurse should make which statement to a pregnant client found to have a gynecoid pelvis? So there are 4 types of pelvis. So before that, we should see the options. First option is, your type of pelvis have a narrow pubic arch. Second one, your type of pelvis is the most favorable for labor and childbirth. The fourth one is, your type of pelvis is a wide pelvis but it has a shorter diameter. You will need a cesarean section because this type of pelvis is not a favorable for a vaginal delivery. The answer is gynecoid pelvis. It is the most favorable for child and birth, labor birth. So there are 4 types of pelvis, namely gynecoid pelvis, anthroid pelvis, anthropoid pelvis, and platypelloid pelvis. See, gynecoid pelvis is a normal female pelvis and it is the most favorable for successful labor and birth. Second one is android pelvis. It is resembling a male pelvis because it is unfavorable for labor because of the narrow pelvic planes. Pelvic planes are narrow. An anthropoid pelvis has an outlet. Outlet is adequate, but it is a normal or a moderate pubic arch will be narrow pubic arch. In a platypelloid pelvis, it is a flat pelvis. Platypelloid pelvis is otherwise known as flat pelvis, has a wide transverse diameter, but the anterior posterior diameter is short, making the outlet as inadequate. Next question is, which purposes of placental functioning should the nurse included in the prenatal class? Select all that apply. See, options are: it cushions and protects the baby, it maintains the temperature of the baby, it is the way the baby gets food and oxygen, it prevents all antibodies and viruses from passing to the baby, it promotes an exchange of nutrients and waste products between the mother and developing the fetus. So the placenta, functions of placenta. So the placental functioning is mainly provide an exchange of oxygen, nutrients and waste products between the mother and the fetus. So it is a very important functions. So these are all about the general basic information related to maternity nursing. Thank you. If you like this channel, you can subscribe to me and ring the bell button. You will receive my notifications. Thank you.